Hiya.
Aye, what did the doctor say?
I don't know, it was all a bit of a blur. I didn't really understand, but I didn't dare ask.
Been looking at the information on this packaging. What does this mean for Darren and his diabetes?
I know this is important, but I'm not really sure I understand it.
Okay, I've had lots of people say that sort of thing to me. Shall we sit down and go through it together?
Yes, please.
Health literacy is important to all of us, but many of us don't fully understand what it is. So what is this thing called health literacy? Health literacy is about the skills, abilities and resources that we can use to make informed decisions about our health and well-being. We can get these from our own personal skills, abilities and experience, our families, friends, professionals and the communities we live in. Health literacy is also about the people who work in healthcare or anyone who works in care or caring services, communicating clearly with us and working with us to help us make those informed decisions about our health and well-being. About half the adults in Stoke-on-Trent have low levels of health literacy. This means that they may struggle to read, understand or use health information. And many of the healthcare workers and organisations need to do more to support the health literacy needs of the city. We're surrounded by health information on a daily basis, and it's not just on a visit to your doctor. Health information can be complicated, and we all have a role to play in helping to make things better, whether we are health professionals, members of the public, or providers of public services, such as the fire service, police service, or local authority workers. Health literacy relates to information about health and well-being that is written down, on a screen, or spoken, so that we can use it to make the best decisions for us about our health. Good health literacy can have a positive impact on our health and well-being. It helps us to make informed decisions. If we improve health literacy in our community, then it will be easier to understand how to take our medicines and why we are taking them, easier to understand how to manage long-term illnesses if we have them, easier to know how to get the right help, easier to know how to take care of ourselves and our families. Patients, doctors, hospital workers, pharmacists, health visitors, carers, people working in the emergency services, anyone who plays a part in health. We all have a role to play in improving health literacy across the community. And here are some of the ways we can improve health literacy. Think about how many times you see information which could affect your health. It's no surprise we can find this amount of information a little overwhelming. Health information and conversations can be found in many places. At the GP's surgery, at the pharmacy, on food labels, at the gym, on TV or online. These are just a few examples. We see health information all the time, and understanding it and being able to use it is crucial to our health and the care we receive. So let's take a look at some of the situations where health literacy and our understanding of healthcare might happen and what we can do to understand this information better. It will come as no surprise that one of the main places we will encounter healthcare information and have conversations about our health is at a GP's surgery. It's natural to be a little anxious or concerned, but staff are there to help and will answer any questions you may have. Therefore, as a patient or customer, don't be afraid or embarrassed to ask questions or ask healthcare professionals to explain things if you do not fully understand them. It is okay to ask if you don't understand. It is the responsibility of a health professional to be understood. Research has shown that when people don't fully understand information about their health, they are less likely to be fit and well.
Hi Vicky, nice to see you again. And you've come this morning to talk about your blood test results, is that right? Yeah, so we did some tests last week, and you remember last week we were talking particularly about blood sugar.
Yeah.
Yes, and so we did some tests last week because we've been talking about diabetes in the family and things. And as you know, one of the tests we did was to look at your blood sugar, and that has shown that you have got what we call type 2 diabetes.
Okay, so, well, what does that mean and what should I do now?
One of the things you could consider to help improve your health literacy is Ask Me 3. You should ask, what is my main problem? What do I need to do? Why is it important for me to do this? By doing this, it will help you better understand what is being said or shown to you and what you need to do next. You could also take someone with you if you want to. Sometimes it is easier to ask questions and remember answers if there are two of you. A visit to your local pharmacist can be a little overwhelming, as we can be presented with lots of information. The pharmacist and their support staff are there to help, and if you don't understand which medicine you need, for example, you can ask them for their advice. Health literacy is important and relevant in lots of different situations away from the medical profession. Think about some situations where you might be presented with information about your health. The local gym, for example. Instructors at the gym are there to offer training, advice and encouragement. They will also talk to you about your body, your health and your well-being. They may use jargon or talk about things you do not understand. If this is the case, just ask them to explain what they're talking about. It's not just about the patient understanding what is being said. Health professionals need to make sure what they are saying can be understood. There are a number of ways in which health professionals can help improve health literacy. First of all, there is the teach back technique. The importance of teach back is moving away from simply saying, "Do you understand?" The health professional should avoid asking questions such as, "Is that clear?" and "Have you understood everything?" because it is very easy for people to simply answer yes, and instead they should use questions such as, "To be sure that I've explained everything correctly, could you explain to me how you will take your medication? We discussed a lot today. Can you tell me what you found most important? So that I can be sure I've given you clear instructions, please show me how you will use your asthma inhaler at home."
Okay, so we've covered a lot in this short appointment this morning, so I just wanted to make sure that I've got everything across that I wanted to in this appointment and make sure that I've not missed anything out. So can you just tell me what it is you think that we've discussed this morning?
So I think you said about diet and exercise being important, and that also to see the practice nurse to get some more advice and get my feet checked. So I'm going to make an appointment with the practice nurse like on the way out.
You could use diagrams and charts to explain information. These are effective ways to visually represent important information and help patients better understand. Use simple language, avoid jargon. Information that might seem simple to a health professional might not be easy to understand if you are not used to the words, language and phrases being used. So keep it simple. You could relate things to everyday life.
So have you had this medication at all before?
Never.
Okay, so this medication is there to reduce the amount of cholesterol that's going around in your body. You can get a few side effects. One of them is achy calves. Okay, so can you tell me where your calf is?
Calf. Well, last time I looked, it was somewhere below my kneecap.
That's right. And also you can get black poo. Now, if you do get any of these side effects, then you do need to come back to speak to me about it. Is that all right?
Yeah, I understand all that.
Okay, so with you saying you understand it, just so that I can make sure that I've given you all the right information, could you just tell me again what I've just told you about the side effects and when you've got to take it?
Produce easy to read and understand printed material. You should ensure that any written material, such as patient information leaflets, letters and forms, are written as clearly and simply as possible. Ask if they'd like any help. Some patients may feel unsure about information, so ask if they'd like any help or assistance.
Hello there, can I help you at all?
Oh, hello, yeah. I think my children might have nits, but I'm not sure, and I'm just wondering how I can find out and what I need to do to treat it.
Okay, why do you think they've got nits?
Well, it's going around school at the moment, and I've noticed that they've been scratching their heads quite a bit.
Okay, well you need to first of all find out that they have definitely got the nits, because any of the treatments, they won't work on anything that's not a live lice. So you need to comb through the hair with one of these little fine tooth combs, and then you will find the little nits because they will actually pop out onto a piece of paper.
All right, okay, well thank you. Well, that sounds great then.
So will it be you when you get home that's going to be doing this combing through?
Well, it might be me, or it might be my wife actually, I'm not sure.
So you need to make sure that your wife actually knows how to do it. So how are you going to explain that to her?
Well, I think you've just said that I need to take one of the combs and comb through the hair and do it over a white piece of paper, and they look like little black specks when they fall off, so I can comb through, check the white paper, and I'll see on there if they've got nits.
That's it.
Does that sound okay?
Yeah, that's fine. That's super.
There are lots of professions directly and indirectly involved with healthcare, and you may not automatically realise that you are dealing with healthcare information or the importance of health literacy to you and your customers. For example, you may work at a gym. On a daily basis, you could be offering information and advice to customers, and it's important that they understand what you are trying to communicate. You may be offering advice on gym routines, how to safely use equipment, or general health advice. And what's important is that your customers understand what you're trying to communicate.
Okay then, we're on the exercise bike now, and we're predominantly using our cardiovascular system.
What exactly is that?
It's basically increasing our heart rate, getting you breathing heavier, which ultimately gets you fitter and healthier.
By working together, patients and healthcare professionals can improve health literacy across Stoke-on-Trent. And if we do this, we can improve patient care, hopefully save time and money by reducing the number of repeat appointments, improve the services we offer, and ultimately improve lives across the city. If you have any further questions, or if you'd like to find out more about health literacy, then you can contact the Public Health Department on 01782 234 234 or email public.health@stoke.gov.uk.